All right, this next section is going to be kind of short, just a couple of small things about the large intestine. See what I did there? Okay, so let's talk about some pathologies, some things that can go wrong in the large intestine. One is diverticula. These are little pockets that develop on the haustra. So it's not the haustra themselves, it's these little extra pockets. And you can see them in an endoscopic view of the colon as these little holes here. They're most common in the sigmoid colon, and they're likely caused by a low fiber diet, which makes the feces harder and denser and puts more pressure on the walls of the colon. So as a result, the colon develops these little pockets. So eat your fiber if you don't want diverticula. The presence of them isn't necessarily going to be noticeable at all. You may have them and they don't get infected, and you would have diverticulosis, meaning that you have them, but that might not be a problem. If you have diverticulitis, then one or more of these became infected. And again, that might happen because feces got compacted in there, and then the bacteria in the feces overpopulated and produced an infection. So yeah, eat fiber. Fiber really, really does help to smooth the passage of food, and especially the waste, through the colon. It also feeds the mucus that it helps, the bacteria in the colon actually help to make mucus. So if you have enough fiber in your diet, the bacteria in your colon will actually make this mucus layer thicker. And that's actually going to make your whole colon healthier. The other thing that can happen is the development of groups of abnormal cells, which are called polyps, little tiny things like this. Most of them never turn into anything, but occasionally they can develop into colorectal cancer. This is a cancer developing in either the rectum or the colon. Polyps, most of the time there are no symptoms, and very often colorectal cancer doesn't even show any symptoms, which is why doctors recommend that people, once they get to an age where they are more at risk of colon cancers, starting at age 50, that they get a colonoscopy every 10 years. And a colonoscopy is where they put an endoscope, a camera, up through the whole colon to look for polyps and cancers. And the reason they recommend that is because so often colon cancer doesn't have any symptoms until it is very, very advanced. The symptoms, when they do occur: rectal bleeding, severe constipation, abdominal pain, and sometimes unexplained weight loss. Now, so that's your colon. All right, the rectum is a retroperitoneal structure. So the peritoneum is going to end here. The rectum is this muscular tube at the end of the sigmoid colon that's going to accommodate the fecal matter that's been totally processed, and now it's just waste. It's going to empty into the anal canal. The inside of the anal canal has these little ridges called rectal valves. And you've never heard of rectal valves probably, but they are your friends. Their job is to make sure that the poop stays in the rectum when you fart. You're welcome, rectal valves. So the fecal matter leaving the body leaves through the anal canal here, out the anus. The anus has internal and external sphincters. So there is 2 layers of muscle that have voluntary and involuntary control. So yes, it is possible for someone or something to scare the shit out of you. And that's the end of that portion.